Hey guys, it's Leah and you're watching Mommy in the Moment. Today we're talking about embarrassing pregnancy symptoms and hacks that I've determined can help improve them. Welcome or welcome back. You're watching Mommy in the Moment. Let's talk about these embarrassing pregnancy symptoms and what we can do about them. All right, so as you may know, I'm going through my third pregnancy. I've just entered the third trimester. So many of these symptoms are no stranger to me personally, but I'm also very familiar with them because my patients talk to me about them as an OB doctor. So let's get into it. First hack, buy bigger underwear, okay? Starting early in the first trimester, the girls, they're gonna blossom, they're gonna get bigger. But your pelvis is also gonna start kind of adjusting and spreading and getting a little bit wider. So you may wanna invest in some more comfortable bras and panties. Now they don't have to be expensive. I got I got two bras from Walmart. I made sure that the band around the chest was bigger because your chest actually grows by a few centimeters during pregnancy, and the cup size was bigger because stuffing your girls into a bra that's too small, that don't look good. That don't look good. And then I went to like Marshall's and found some larger underwear that was very stretchy, that didn't have a tight waistband or tight bands around the leg hole, and it's so much more comfortable. Like just do it. Don't wait. Just do it. You may also want to go ahead and size up in some of the pregnancy clothes or maternity clothes that you buy. Most places will tell you to buy your pre-pregnancy size, but I found that in a couple of pieces, sizing up to a large, which is not what I usually wear, but sizing up to a large made it much more comfortable, and it made it a piece that I could use throughout the entire pregnancy. All right, my second tip, wear panty liners. Increased discharge is a normal part of pregnancy as long as it doesn't smell or have an odor, or it's not irritating. A little bit of extra discharge or a lot of extra discharge can be really normal, but that can also make you very uncomfortable as far as dampness or odor throughout the day. So what I recommend is that you put on a panty liner, bring a couple with you, especially if you're not in a situation where you can change your underwear frequently. Just change the panty liner out, and it helps you to stay feeling dry through the day, and not holding that moisture there to cause irritation or odor later on. My third tip, put deodorant in all the places, okay? During pregnancy, your hormones are up and down, mostly up, and they can cause you to perspire much more, to basically have what I like to call the pregnancy sweats. And a lot of times that sweating happens in the normal places, like under your arms, but it can also happen in the creases of your breast or in your groin, or for me, where my belly folds over and touches my legs when I sit down. So what I'll do on my work days is I'll use my normal stick deodorant underneath my arms, and then I'll use a spray deodorant, and after I put on my underwear, make sure it's after, don't spray deodorant in your lady parts, not a good idea. But after you put on your underwear, spray deodorant in your groin, spray it under the crease of the belly, maybe spray it underneath the kind of where your breasts fold, and that can help keep you dry, help keep you feeling like a little fresher throughout the day. Sometimes I'll even put it on my low back, or you can use like a cornstarch based powder like Gold Bond in certain places if you feel like you're not gonna get too messy with your clothes. I know I'll probably get a lot of pushback and backlash for talking about putting deodorant other places. There's a lot of controversy about aluminum-based antiperspirants and things like that. Y'all, this is just what works for me. I just don't want to go through the day sweating like a pig. I just can't do it. Especially being in my third trimester in the middle of the summer. No, honey, I can't. So this is something that's worked for me. It's helped me to manage an embarrassing symptom. So hopefully it'll help for you as well. All right, Another common pregnancy complaint that not many people talk about is varicose veins. And I'm not talking about in your legs, I'm talking about in your lady parts. So you can get some kind of uncomfortable swelling and fullness down yonder, and that can be completely normal, okay? Now, if you're having pain with intercourse or things like that, you need to talk to your doctor about it. But if it's just a little bit of fullness, especially at the end of the day, take a mirror, look down there, see what's going on. You should be very familiar with what you are like down there. And so one thing that you can try is putting an ice pack. But my favorite ice pack for the lady parts is a frozen bag of peas. So get one of the smaller bags of frozen peas, wrap it in a thin washcloth, and you can apply that ice pack to your vulva, and that will help with swelling and discomfort. All right, last but not least, my most embarrassing pregnancy symptom, and maybe some people don't think this is embarrassing, but I do, is that I snore. Especially in the third trimester, you guys, I snore like I'm trying to wake up the heavens. And it's a combination of progesterone relaxing all the muscles in the back of your throat, general weight gain, and then fluid retention. But what I have noticed this time around is that there's a big component for me of postnasal drip. So just like you can have the pregnancy sweats, it's very common to have the pregnancy snots, okay? It's called rhinorrhea of pregnancy. Basically, the lining of your nose makes a lot more mucus. Some people, you blow it out and it's, coming out this way. For me, it shows up as postnasal drip. And that mucus kind of gets stuck behind the top of my soft palate, right at the back of my throat, and it causes me to kind of snore. That snoring causes more swelling, which then makes everything more full, and then it makes the snoring worse, and so it's this big, horrible cycle. So what I've done this time is I've had a very strict medication regimen to try to help calm all this down. So I'll use a saline nasal spray. I'll use 2 different antihistamines, Mucinex to help clear the mucus out. I'll also sometimes use a neti pot to physically flush the mucus. Vicks Vapor Rub, the lavender kind that you can use at night, on my chest and on my nose. I'll use my diffuser with some peppermint essential oil, a combination of essential oils to really try to keep things nice and clear. And it's not perfect. There's still nights where my husband's like, yeah, you were rumbling, girl. But there are also many, many more nights than I have had where I wake up and my throat still feels like a normal person. So I hope these tips were helpful. If you're having any concerning symptoms that you're not sure what to do about, definitely talk to your provider about them. But these may be some things that you can start with. Definitely talk to your provider before you start any medication regimen, even if it's over the counter, to make sure that it's something that's safe for you. And if you guys want to hear more about pregnancy tips, tricks, and how I'm getting ready for this third baby, definitely subscribe. Comment down below what kind of things do you want me to talk about. I'll be able to tailor the videos to what you guys want to hear. And I hope that you guys have a wonderful day, and we'll see you in the next one. Bye.